couple of minutes. I'd like to make an announcement before the meeting. Any person making impertinent or, it's good to try to read this, or slanderous remarks, or who becomes boisterous or while addressing the commission shall be barred from further audience from the commission by the presiding officer unless permission to continue or again address the commission is granted by a majority vote of the commission members present. I'm also going to call your attention to a letter that was disseminated yesterday by our county administrator, Virginia Baker, and she has said that based on the most recent recommendations of the CDC, citing individuals who are fully vaccinated may go without mask inside buildings, and in consultation with the director of the Department of Health for Palm Beach County, effective today, all fully vaccinated individuals are not required to wear a mask inside county buildings. Fully vaccinated equates to a person receiving both shots of Moderna or Pfizer and beyond the 14-day incubation period after the second shot, or the J&J one-shot vaccine, again after the 14-day incubation. The CDC does recommend that individuals who are not fully vaccinated continue to wear masks indoors and in large crowds. Masks continue to be worn on all public transit, buses, planes, and trains, transportation hubs in accommodation with federal policy, and all other exemptions per the CDC. Certainly, if you feel comfortable wearing a mask, you should continue to wear a mask. You shouldn't feel that you can't wear a mask, and we are going to still socially distance here in the chamber. With that being said, I'm going to call this meeting to order. This is the Board of County Commissioners Board meeting. It's May 18th, 2021, and I'm going to ask for a roll call.
Commissioner Bernard.
Here.
Mayor Kerner. Commissioner McKinley.
Here.
Commissioner Marino.
Here.
Commissioner Sachs. Commissioner Weiss.
Here.
And Vice Mayor Weinroth.
I am here. Thank you. Commissioner McKinley, would you please do the honors of an invocation and lead us in the pledge?
Thank you, Mr. Vice Mayor. Thank you. Dear God, we seek your help with our affairs today. Bless this meeting with your divine intelligence and help us to make the best use of our own. We are of diverse opinion here, yet we wish to reach agreement satisfactory for all. Please share your wisdom with us to help us do right by all concerned. And thank you for your heavenly blessing. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner McKinley. County Administrator, do we have any additions, deletions, or substitutions to our agenda?
Yes, Vice Mayor. On page 55, 3 and 1, we have a revised motion, and that is to ratify a subscription. On page 77, 6G1, that is a revised motion and summary, recommending a motion to receive and file our 2021 storm season preparedness report. That concludes our add, deletion, and substitution page.
Thank you. Do I have a motion to adopt?
Second.
Okay, I have a motion by Commissioner Marino, second by Commissioner Weiss. All in favor, all opposed? That is approved 6-0. It's now time for our consent agenda. I understand Commissioner Weiss would like to make a comment on one of those items, but before I go to that comment, does anybody wish to pull anything from the consent agenda? I see nobody looking to move for a consent agenda. Commissioner Bernard, do we have any comment cards?
No, Mr. Vice Mayor.
Okay, Commissioner Weiss, you're recognized.
Thank you, Mayor. On consent today, I'd like, on item 3 and 1, it's in regards to a new subscription for our library system, and I just want to share my excitement of expanding access to reliable information by entering into a 5-year agreement with Newsbank. Newsbank is an archive of newspapers and magazines not only locally, including the Palm Beach Post and the Palm Beach Daily News, sometimes referred to as the Shiny Sheet, and the Sun Sentinel, but it includes publications from all around the country. And though the internet has been a really good tool for finding information, sometimes they're not always reliable, and this is going to offer the community an opportunity to access content from around the country from media organizations. And with that, I'd like to extend my appreciation for Doug Crane and his staff for moving this item forward. I know that I and members of my staff are certainly going to be utilizing this opportunity to have access to these publications. And just a brief comment, you know, during the pandemic, I want to just recognize the work that the library did during this time. They had 22,000 new library card holders this past year. They had 2.35 million visits to the libraries during the pandemic, 6.4 million visits to their websites, and 161,860 sessions using their search, online search and research tool. 1.9 million electronic materials were used or checked out. 5.8 million physical items were checked out, and 934,000 research transactions were handled by library staff. Currently, we have almost 500,000 card holders in Palm Beach County Library. So I really want to extend my thanks for the great work and recognize what we're doing over at our libraries.
Thank you, Commissioner Weiss. I mean, I remember the commercials used to play on TV when I was young. It's the latest, it's the greatest, it's the library. And certainly we have unmatched collections here in Palm Beach County, and people should take advantage of it. You don't have to go out and buy a book if you want to just read it. So with that, Commissioner, would you like to make a motion to approve the consent agenda?
Yes, Mayor, I certainly would.
Okay, do I have a second? Seeing a second by Commissioner Marino, all in favor, all opposed, that has passed 6-0. It's now time to have our friend from the Department of Health, Dr. Alonso, and county staff come on up and tell us all about this little thing called a pandemic. Hi, Mary, how are you?
No problem.
Dr. Alonso, I think we're getting closer and closer to the day that you're going to be able to sleep in and not have to come and join us. You are recognized.
Thank you so much, Vice Mayor. Good morning, Commissioners. Good morning, Ms. Baker. How are you? Yes, I'm very happy to be here today. We've got lots of good news and hopefully some information that we can all share and utilize as we go forward. We are very, very close to coming to an end. We can really see the end now, and it's my pleasure to share some of this. I have a little bit of different data today so that you can get a grasp of how the country and how we are doing here in Florida. Mary will give you all the graphs and all the numbers and so forth, so I want to concentrate more on some of the highlights. Starting with our national look, I went ahead and put all the dates back on here so that we could see, and this end here is the last month, and we can see this continuing to go down. They have new graphs. If you go on the dashboard and you go on to the global, you can see some new information that they have there. They have now the graphs of the deaths and the vaccinations also plotted, so new data that's available on the dashboard. This is the graph showing the cases in the U.S. in the last 30 days and the deaths. So we see that they're both on a downward trend. The 32,994,339 cases with 586,359 deaths and over 200 million vaccines, and we hope to get to 300 very, very soon. So the vaccines are definitely continuing to go up, although they are at a slower pace, but they are still getting into people's arms, and here in Palm Beach County, we continue to vaccinate. So very happy to see all this. This second graph shows the level of community transmission, okay? And we see that it is on the levels from high, substantial, moderate, and then low. The country has switched from high to substantial, the orange. As you can see, we have a lot of states now that are in this orange level as opposed to the high. Florida and a few states, it's not very, it doesn't show as sharp on the big screen as it does on my little screen here. Hopefully on your copies you can see it a little bit better. But, you know, we're still in a high level of transmission for all of Florida. However, when we look at the number of cases reported to the CDC in the last 7 days, it's also graded from these grades here that you see from 0 to 400 and then all the way up to the higher ones over 1,000. And we still fit in the 1,000. Florida, Texas, California, New York is still on there, but a lot of the other states have come down. So that is promising, and our numbers continue to go down. Our next graph shows us a little more granular here in terms of our county, where we can see once again the level of community transmission, and we have made a big switch from the dark high to the substantial for Palm Beach County. So you see that Broward and Dade continue to be on the high level, and we have gone one level down along with our partners to our north and to the west. So that's very good news for us. Now, we still have to be careful, right? Just because things are looking good, we don't want to slip and go backwards. But so far, we've been doing very good, and a lot of this is attributed to the vaccinations that we're giving. Our next graph shows us now in terms of the new cases. So I'm showing you both the level of transmission and the cases. In terms of cases, we're still at the not the dark blue that we were at one point, but we're in the lighter blue along the same as with, and this will continue with these numbers, according to the numbers that we're getting now. I think we're going to still be there for the rest of the month and probably the summer in terms of our numbers. But again, a switch from the dark blue to the lighter blue. And we can see along the Panhandle and north of the Bend, a lot of counties are doing very, very well. So when you hear about counties doing certain things, you know, Florida is a very large county, a large state, and certainly the population in many of these counties is very different. So it's very important that we know our own local number of cases as well as our transmission rate, which influences our decisions here locally. This is just to show you the number of cases, Florida versus Palm Beach County, and Mary has it, the whole graph, but just to show you the numbers, and you can see them coming down, you know, especially with this 1,000 on the 16th. It's still close to 2,000, but you can definitely see this coming down. As far as for us, now we're in the 100. Our average for the past 7 days is 189. The week before that was in the 200s, and the last times we reported, they were all the way up to the 300s, right? So we can definitely see this coming down, and we're doing a great job then with our contact tracing because we're able to easily identify people, and we're still having to quarantine people that become positive and that need to stay home, but certainly the numbers are much lower, and folks are able to give us better information. So that's all very positive. Now, this graph is one that concerns me because how many of you remember what our 5 to 14% of new cases was last time? Well, you can cheat and look below. It was 10. it's gone up to 15. So we have more positive cases in this younger age group, new cases. We had 18 new cases in the 5 to 14-year-olds, which makes it 15%. So if you take this whole box, we're talking about 87% of our cases coming in under the age of 65, right? That's disturbing for many reasons. It's disturbing because this is a group that's going to be the hardest to vaccinate. And as I show you the numbers for our vaccination, you will see that this is where the problem lies, and this is where we have to concentrate our efforts, especially for these children that will not be able to get vaccinated yet, right? So we have a group here. Now with the Pfizer, it goes down to 12, but we have the 5 to 11-year-olds that are not getting vaccinated and are becoming, there's more children in that area becoming new cases. And again, no one wants to have the concern about the long-term consequences that may result as a result of the COVID, so especially for younger children. So very important that we keep track of this and that we keep this in mind as we go forward. So here's the vaccine summary. You see that while we have vaccinated, and this, I did this calculation, just the general population, okay? I'm not taking out who is included and not included, just the general population to give you an idea of where we are. When they say total people vaccinated, it's a little bit of cheating, right? Because they're using people who only have one dose. I'd rather look at the series completed, those people who have completed either the 2 doses in the Moderna or the Pfizer, or they've had the 1 dose of the J&J. Those are the people that are really protected, not the ones with just the 1 dose. So if you look at that for Florida, the series completed is only 34% of the general population, the 22 million people that we have in Florida. So if you take out the numbers and do all that, the number goes up a little bit, but the point is it's less than 1/3. So obviously that does not give us herd immunity. So what does that mean? That means that if you're not vaccinated, you still have to worry about the virus, you still have to worry about the variants, you still have to worry about all these things. That is why the national campaign is all about getting vaccinated. In Palm Beach County, what do we look like? Well, we look a little bit better than the state, but Broward and Dade are doing a little bit better than we are in terms of vaccinations, especially with the younger group. So for us, that series completed is only 36.6%. So a little bit higher than this, but nowhere near where we can say that we have any kind of immunity in terms of the community or being able to protect ourselves from that perspective. Now let's look at it a little more granularly and take a look at the age groups. And I used Palm Beach, Broward, and Dade. I don't know what the heck those lines are they're going across, so something happened on this chart, but this gives you an idea. Just look at the percentages here, right? So what it does here, it takes a look at the 16 to 19-year-old. So it breaks it down into a little bit. When we say that we have vaccinated X number of people from 16 up, and we do that calculation, we're including in that the 84% of the 65 and over that we have vaccinated. So the number looks much better than when you look at just who have we vaccinated 16 to 19. And we don't have the chart yet for the 12-year-olds because very few 12-year-olds have been vaccinated at this point. So for that number, it's only 26% for Palm Beach, 34 for Broward, 31 for Dade. Now, we are doing better in all cases. We're doing better than the state, but we're not doing better than Broward or Dade. And the same goes for the 20 to 24. We're only at 30%. Look at the numbers here, and 28% for the 25 to let me see if I can get on this one. The 25 to 29-year-olds. So these are the lowest numbers up here in this bar. Now, as we get a little older, the percentages increase a little bit. So we're at 34% here, 39%, 46%, 48%. See, it's going up as we get into the older age group. And when we get to the 65 and older, now we're at 84%. So keep that in mind when they report out 16 and 65 and over, we're doing great, right? Well, when you go from 16 to the older, it's that percentage of those over 65 that we have vaccinated that increases that number. This is the reality in terms of the younger youth that has been vaccinated. So, things are looking really good. Today, it's not official yet, but we actually had a 2.89 daily positivity, which will be reported out tomorrow. So just to give you a heads that we're going in the right direction, that is very good. But we don't want to lose track of what we still have to do. We still have to vaccinate a lot of people to be able to get anywhere near herd immunity so that this can be over. And we need this to be over, right? Please. So, what are my concerns? My concerns is the confusion that has occurred because of the CDC and the president's statements regarding the vaccinated individuals not needing to wear masks outdoors or indoors unless in a crowded circumstance. And unfortunately, the only thing that people hear is that vaccinated people don't have to wear a mask. So even if you're vaccinated and you are indoors in a crowded space and you're indoors in a situation like a stadium, a concert, or a very crowded restaurant, you should probably still have your mask on when you get up and go to the bathroom and do those things. So you need to carry your mask with you or you're going to forget and not have it with you. It also states, and nobody really talks about that either, the only statement you hear is vaccinated people don't have to wear masks, and that's for an incentive. That was done for the purpose of saying, hey, if you get vaccinated, there's an advantage, so get off the fence and get vaccinated. But the fact is that if you're not vaccinated, those masks still are still recommended. Why? Because we have a ton of variants that are very contagious. Indoor, we know that in close proximities and in enclosed areas with circulation that's not very good, the virus can actually get aerosoled, and so we can inhale it very easily, especially in a crowded area, and all the other reasons why the masks still need to be worn inside. Obviously, in hospitals and medical facilities, they're still going to ask you to wear masks because we have immunosuppressed people and other conditions in medical situations. And so many stores are still going to require wearing the mask and so forth. So there's still going to be recommendations out there because this is not over yet. So that concerns me. There's a lot of confusion and people are asking that all the time. The second part is, just the note that the concern that I have here about the recommendations of needing to be masked indoors if you're not vaccinated is especially that 5 to 11-year-old that cannot be vaccinated or people who cannot yet be vaccinated. I have employees at work that are very concerned about coming back to work because people may not be masked around them. So they have to wear their mask, but they're still concerned. They're afraid. So we have to work with all that and try to accommodate some of these folks. And then my last concern is the several holidays. We have Memorial Day, the 4th of July. If you remember, this time last year, we were concerned about that, and we had spikes in both of those holidays, and that's when our graph started going up and went very, very high. So this is not over. So despite all the efforts that we're doing, we still have to be very vigilant, continue to do our cleaning, our hand washing, and for those people that are not vaccinated, I hope that the public continues to wear their masks, whether or not it's mandated or not mandated. I believe that the majority of the people will continue to do the right thing and help us get to the end of this pandemic, which we will get to eventually. So with that, I'll wait for Mary's detailed graphs.
Commissioner McKinley, can we wait until we have both presentations? Very good. We'll go to our Director of Emergency Services, Mary Blakeney, and spoiler alert, I see all green on our resurgence indicators.
Yes. Good morning, Mayor, Commissioners, Administrator Baker. On this 420th day of the EOC activation, I'm presenting you the COVID-19 phase restart program. You can follow along on the matrix that was provided to you. As you noted, as you see on the matrix, we've met all of our indicators this week on the matrix. And Dr.
Oh, yes. I always steal this from you, don't I?
Okay, so I just want to briefly go through the numbers for you this week. The upper right-hand graph shows the overall positivity rate, which has decreased for the second straight week. We're currently at 16.44%. The lower left-hand graph indicates the last month of testing, and the red line is a running 7-day average. When we talk about the daily lab positivity, this week we saw the 7-day and 14-day positivity rates drop for the fourth week in a row. The lower left-hand graph shows our daily lab positivity rate now averaging 4.4%, which is below the targeted 5%. As we look at our hospital census, as the chart in the lower left shows, over the last 3 weeks, we saw a decrease in patients hospitalized with COVID-19. We are currently seeing less than 3% of our total hospital beds countywide being used for COVID-19. As it relates to the deaths, the graph in the upper right corner shows the COVID-19 related deaths have declined. Our current death rate stands at 1.92%. As far as our ICU cases, over the last month, we've seen our COVID-19 patients in our intensive care units countywide fluctuate. The graph in the upper right shows the overall COVID ICU cases since May 2020. The graph in the lower left corner shows the last 2 weeks trend. At this current time, approximately 49 patients a day account for ICU bed utilization countywide. As it relates to our Palm Beach County Fire Rescue Med Alerts, this is a representative countywide sample of people with COVID-like symptoms. We can see by the chart in the lower left corner that Med Alerts have declined. This past week, an average of less than 4 patients a day were transported. As far as our emergency departments, we have seen that weekly counts of emergency department visits presenting with COVID-like illness have decreased over the last 3 weeks. This week, our COVID-like illnesses decreased to 396 visits. As far as our testing, residents continue to have access to at least 115 sites. We have conducted over 893,000 tests. Just as we have started to transition from our mass operations at our vaccination sites, the state is doing a similar transition for testing sites. All state-led and state-supported testing locations will be closing at the end of this week. Working with our Public Affairs Department, we will continue to provide a list of resources on our county website where residents can go for testing. With the network of private providers, pharmacies, and public health clinics who provide testing, we feel this combination of these resources will meet the current demand for testing. As it relates to vaccinations, we continue to have multi-agency leadership calls. As we transition away from our mass vaccination sites by the end of the month, we have shifted our focus to the rollout of our mobile vaccination strategy. This strategy includes working alongside the healthcare district to advertise, work with our municipal and community partners, and leverage any state-provided resources to facilitate targeted vaccine distribution within the county. The healthcare district mobile plan includes targeting children as young as 12 and areas of the county showing a lower percentage of participation in vaccines. The plan also brings the vaccines to where people are in the community and entertainment districts, as was demonstrated recently with the initiatives done at the South Florida Fair and the entertainment district this last weekend on Clematis and Datura. We continue to have calls with the state EOC and our municipal partners as well as our hospitals. In closing, our previous presentation of the CPR matrix showed 2 red areas. This week, we have no red indicators. We are seeing our community response to having vaccinated over 702,000 people in Palm Beach County pay off, but we can't let our guard down. We need to continue encouraging people to get vaccinated while we wear our mask, wash our hands, and watch our distance. That concludes my report.
Thank you very much. 428 days seems like only yesterday. Commissioner McKinley, you are up.
Yeah, thank God. That light at the tunnel is shining brightly right now. Hopefully it continues. Dr. Alonso, zip code data?
I'm sorry?
Zip code data?
The zip code data. Did we send those maps out?
The maps were 18 and up. I don't think I've seen one that was 16 and up.
The last one was 16 and above.
Okay, can we?
Now, the map, I don't have it, because I haven't gotten a copy of the map myself, so I don't have it on my computer. I believe you all got the maps. And again, those maps are going to help us zoom in on the areas that have less participation. But don't let it be misleading, because what it's showing you is 16 and above that have been vaccinated. So all the areas are, the lowest area is about 25%. But that 25% is misleading because it has the 65 and over in there. So that is why I'm telling you that the maps are going to be very useful to see where we're going to go, but it doesn't mean that those zip codes have 25% coverage yet.
I understand. I think it would be beneficial for the public to see the zip code data as part of your presentation. And what I noticed from the maps I reviewed yesterday, when it was through April, it was the 18 and over, was what I suspected. Heavy vaccination rates in the coastal communities, very heavy, high, wonderful vaccination rates in the south end of the county, very low vaccination rates in some of our more challenged communities, and 2 of the lowest zip codes in the county were in the Glades, mostly the Pahokee area and then the unincorporated area around Belle Glade.
That is accurate. That's correct.
So, it's surprising to me. I guess amateur analysis would say that a lot of people that utilize that Pahokee vaccination site probably weren't from Pahokee if the area has only got 22% vaccinated. So in addition to targeting our mobile units to these communities, I know Marsha Andrews from the school district has also asked that we target mobile units to some of the high schools to vaccinate the 18 and older, which are 16 and up now, which might be a little more difficult now that summer's coming along. But in addition, can we get zip code data for the positive cases that we're seeing?
Yes, we also have that.
Okay, because I would think that a combination of knowing where our hot spots are, much like we saw last year, and knowing where our low vaccination rates are, that we could target resources to those communities.
We give that data to the municipalities every week.
Okay, well, could you give that data to us as
Sure.
well? Okay, but I would like to see that zip code presentation as part of your updates. I don't know if we're going to continue to do these updates at each commission meeting or if we're going to go to a once a month rollout, but the public needs to see that information as well.
Sure.
Thank you.
Thank you, Commissioner, and obviously, as we
Here
look
we
into...
go. They just put it on the screen.
Yeah, I see the heat map, and like the Commissioner said, obviously, Palm Beach, the Barrier Island is very well vaccinated. Kings Point and Century Village are very well vaccinated, but as Commissioner points out, we need to do a better job out in the west and in some of our more challenged communities. And to our county administrator, we have discussed several times PSAs and incentives to try and get those people who are somewhat resistant to maybe come in and get vaccinated. Has something happened with that?
Yes, sir. We definitely have PSAs. We work with our Discover, our Public Affairs Department worked with Discover the Palm Beaches. They're used to targeting certain populations, certain areas in the community, so that is happening. In addition to that, we're working very closely with DOH and HCD on where we're putting the buses. We're actually targeting entertainment venues along with our underserved communities or under-vaccinated communities, which you see in some of the lighter areas. We're going to work with the healthcare district. It got 3 mobile units as we start to demobilize the permanent locations so that we can then put those mobile units into those neighborhoods based on these maps. So we're keeping close contact with these maps and working with the municipalities as well. Because we're going to need their assistance in communicating with their residents and making sure it happens. We're also working, we'll be working with municipalities when there are certain special events going on in their community, making sure we working with HCD as well as Department of Health, because they also have a mobile unit, making sure those mobile units show up at those special events. Because people tend to, what we're finding is those that are hesitant, if it's convenient, they more than likely will take the shot if it's convenient.
That's
We
great.
are working with businesses, and our first one was last weekend, where the businesses decided to provide incentives for people coming into the area. And so they ended up getting a shot, a vaccination shot, and being able to provide that information to one of the bars who gave them another shot. So we did the shot for shot, or they did the shot for shot. Government did not coordinate that effort. But we are looking at other creative means and as well as incentives. We're working with our ARP dollars, the federal stimulus dollars, to see what rules there are and what we can possibly do. I know we're hearing that a lot of other states and counties are doing very creative things to incentivize. I want to make sure we do things that the ad valorem dollars won't be used to pay back in the future. So
Understood.
we're being very careful with what we're doing with incentives. But a lot of businesses are incentivizing their employees as well. And the county is no different. We're also incentivizing our employees to receive the vaccination. But it's a matter of education, and so we're focusing on that. I'm working personally on trying to prepare a town hall meeting in the next week or so for my own employees that are hesitant, getting the right doctors on the call. And then we're also planning a town hall meeting for especially targeting our 18 to 40-year-olds in our community. So that we will be working to get completed in the next couple of weeks as well.
Thank you very much for that update. And certainly, I'm happy to hear that we are, using those ARP dollars in a fashion that's appropriate, as long as it's not going to be a clawback later on. We're used to clawbacks from our federal partners.
Mr. Vice Mayor, could I follow up with one more question?
Certainly, Commissioner McKinley.
Ms. Baker, with the ballpark of the Palm Beaches testing site closing, where can people go to get tested?
Actually, we have an interactive map on our website, and if you go to www.pbcgov.org, click on the COVID-19 section, there is an interactive site that will tell you where every testing site in Palm Beach County is.
Most of the pharmacies have testing and vaccinations, and they're pretty available, and it's free. There are some places that are charging people, but the pharmacies that are getting, the vaccine from the government, those sites are free, and they're advertising free testing. So you don't have to go pay. I know some people are doing it because it's quick and they want to get it right away, and they're traveling and so forth, but the average person can go to the pharmacies. They are free. We're also vaccinating and testing at the Belle Glade area in our clinic in Belle Glade at the health department. And we're testing our patients, of course, at our clinics also. So
The healthcare district is also testing at their health clinics, which are spread throughout our community in the various underserved communities.
Thank you. Commissioner Bernard, you're recognized.
Thank you, Mr. Vice Mayor. I have a couple questions for Ms. Baker. This is in regards to the memo you sent yesterday and the Vice Mayor read today. Just wanted to be clear on, just so the public can understand, are county employees required to wear a mask inside the building?
If county employees are fully vaccinated following the CDC guidelines, they do not have to wear a mask. However, my email to my employees was that we're following the CDC guidelines. However, we don't know who's vaccinated and who's not. And so we have to take personal responsibility and make sure that we're protecting ourselves as well as our family, our loved ones, and our peers. And so I'm going to leave it up to them if they are fully vaccinated on whether they're going to wear a mask or not. However, for individuals that are not fully vaccinated, they should still be wearing the mask. They should still be distancing, and they should also, we'll continue with the sanitizing of our space, our office space.
Follow up, and how would, I guess, what's the enforcement? How would they know, how would we know if they're fully vaccinated or not fully vaccinated?
That is my frustration. You don't know. And so if you don't know and you're not 100% certain, wear the mask. Protect yourself. Protect others.
Okay.
The CDC put us in a very difficult situation. And I think at this point, we just have to depend on each other through personal responsibility. I personally don't believe that's the way public health ought to be handled, but that's what we're dealing with today. And so we each have to take our own individual responsibility and protect ourselves as well as others.
And so I guess, what about the public in regards to, when they come into the building?
We have signage. We're still following, again, the CDC recommendations. If you are fully vaccinated, then you come in without a mask. If you're not, you should come in with a mask and do the distancing, et cetera. I think we all have to be personally responsible. We're responsible for not only ourselves, but our aging parents, our children that are under, that can't be vaccinated yet, et cetera. And so we just need to look out for each other. I believe this community has shown time and time again that they are responsible. If we give them the information, they act in the appropriate manner. And that is why we've been able to keep some businesses open throughout this pandemic, and others were opening and growing. And so I do thank our residents here in Palm Beach County, because they have definitely been steadfast in protecting themselves, their families, et cetera. And so I do want to thank them for that. I do urge them to continue taking safety precautions so that they can continue to move about. We can continue to open and expand businesses. And I thank the businesses for protecting their workers because we all need to protect our workers. That's how we're going to continue to grow.
And then lastly, in regards to, I know in the letter you had mentioned that the constitutional officers would provide their own guidance. Have you had communications with the constitutional officers so in that way the public would know exactly what to expect based on which office that they visit?
I have had conversation and text messages with our constitutional officers. Again, I'm going to urge everybody that needs to contact those particular offices, the tax collector, clerk of courts, along with the property appraiser. Contact their offices direct. They are all doing something a little different. I believe the clerk, in conjunctions with the court, in court-related type activities, those decisions I did not discuss specifically with him. I think the chief judge will need to weigh in on that. So that decision I don't think has been made as of last night. However, in our building, the clerk is going to go along with the county if you're fully vaccinated, et cetera. I know that he will be speaking to his own staff this morning as well. The tax collector still will require at this point masks to do business with the tax collector. The property appraiser will be making her announcement as well today.
Okay, thank you very much.
And I think the overriding message is you need to take personal responsibility for your own health. And the fact is that I think many of us have, protected our personal space. People don't walk up to people as much as they used to. They sort of stand back. People use this fluid a lot more than they used to. And I think you just need to take precautions that are appropriate, as you would during the flu season. If someone's got sick, you stay away from them. So, if we can't have a bona fide system of seeing who's been vaccinated and who isn't, you have to assume the people around you may not be vaccinated and take the precautions. Commissioner Weiss, you are recognized.
Thank you. Couple of questions. In looking at vaccinations by race and ethnicity, and I understand, that we still have some issues going on, or more hesitancy, if you will. And specifically, I know we're trying to target specific areas, but are there specific messages that are being sent out that can potentially resonate or deal with some of the hesitancies going on in some of these communities?
We have to, first of all, respect those people who have still decided that they will not be vaccinated. And we have to respect those people who are still deciding whether or not to get vaccinated. People have to come around to it when they're ready. The messaging continues to be trying to get all the facts and the questions that people have answered. Every time we do a Zoom or a presentation, whether it's live or on Zoom, you have people that have answered questions, and each one of those presentations yields a certain number of people who decide to go ahead and get vaccinated. So that's very good. But it's certainly not the volume. So many of the faith-based organizations, as well as some of the sites that we set up to vaccinate, have run out of people to vaccinate. And it shows by the numbers decreasing and just the volume not being there. So several of those sites are getting shut down. And they're leaving it then to go to the pharmacies to get vaccinated. So we need to continue giving the information for those who need it, but it's getting harder and harder. So right now, it's not a matter of supply, and it's not a matter of being there. It's just the people are not showing up for the vaccines. So I think the targeting through the media is very important, through social media, and through other avenues that will influence folks through their own community groups. I believe that the community health care workers are going to be a critical part of that workforce that will be out in the community, and any event that occurs, whether it's a picnic or a social event. 4th of July is going to be shooting firecrackers, and large crowds are going to be gathering, and we need to be at those sites to then offer the vaccine. So we're taking all those things into consideration, but this is the really hard part. The easy part is over, okay? And remember also that when we do contact tracing, if you're in a group of folks at work who are not wearing masks, then you're all going to be quarantined. And that is going to be very important for jobs, because a lot of us don't have a lot of extra people at work. And you could take out a whole office, especially with the variants that is very contagious. So everybody needs to keep that in mind at work, and as well as at activities and outside events even where there's large crowds. So keep that in mind, that when we do the contact tracing, that's going to affect the number of people that we have to quarantine.
One of the things that I've read about is that there are people that they're willing to get the vaccine or take the vaccination. However, they're concerned because, some people do end up with side effects where, they may have to take a day off work afterwards or something, but that they don't have that luxury of being able to miss work. Do we have any way to help or subsidize that so that, you know, those people that are willing and able but just don't have that ability to miss work to be able to get vaccinated and you know?
Well, that's a much larger systemic problem that we see not only here, but throughout the United States, right? And the pandemic has highlighted all those issues. People who work who do not get time off when they're sick, that's a huge problem. The whole issue of the inequity between race and ethnicities that have overwhelmingly affected many of the black and brown communities. All those things are issues that are not going away when the pandemic stops. And they're issues that we need to continue to address in terms of equity and in terms of how we provide health care and how we have our labor force protect employees. That's an old issue. I don't know if you remember, we had this thing called a hepatitis A outbreak that had occurred that all of a sudden went away. It didn't go away. We just have been doing it quietly behind the scenes. That's a big issue where people that go to work sick contaminate then other people and contaminate the patrons in a restaurant. And so that's a very good example of how if workers were allowed to be off, they would not be coming to work sick. One of the wonderful things about the flu season this season is because people were wearing masks, we didn't have the problems with the flu. People didn't have to get antibiotics and inhalers that usually have the flu. So these are all issues that are not going away, and we have a long road to continue to work on those. And I hope that the pandemic, this is one of the good things that come out of this pandemic. It's not just here, it's globally these issues are occurring. And we're not going to resolve them because we live in a global world now. So we can't just isolate ourselves and say we'll take care of Palm Beach County. You know, people come traveling from all over the place, and we have to deal with these issues broadly. But definitely the work issue is a big, big one.
And then my last question is, do you have any guidance for people if you have somebody that's immunocompromised at home or young children at home? What would your advice be to folks on how, you know, in regards to masking and other behaviors that they should be pursuing?
Well, those are the people that have to continue wearing masks, because I have a mother, a sister, and myself are immunocompromised. So I am definitely not going to not wear my mask when I go out into a crowd. The director of the CDC herself said that if she goes to a movie theater, she will be wearing her mask. As long as people know the risks that they are taking, it's okay. My concern is that these risks are not being talked about. So your vaccine is 95% effective. This is a marvelous vaccine. I mean, it works really, really well, but it's not 100%. And you can still catch this. And if you are with folks that you don't know what they're doing, they could spread it to your family, and they could spread it when they come over. So those people immunocompromised are going to have to be extra careful, and those are the folks that hopefully will be wearing their masks even when they go into, especially, I mean, obviously I'm not going to wear my mask if I'm just walking or well, I don't jog, but let's say I'm walking down a path and just, you know, casually outdoors, you know, away from people. But the moment that I get into a crowd, I put my mask on. And as a matter of fact, I did that this weekend. I went out and there was several events that went on, and people were surprised. I said, Dr. Alonso, why are you wearing your mask? You're vaccinated. I said, I'm in a crowd. Look around. Nobody was wearing a mask. I was the only one with a mask. Well, so I'm the odd duck out, but, you know, I can't afford to take that home to my mom or to my sister or to myself.
Thank you. All right. Thank you, Mayor.
And I think I think the point of that is that you shouldn't feel like an odd duck, that the fact
okay.
is, if you're putting on a mask for protection of someone at home, that's certainly, within your personal privilege, and someone should not feel intimidated by putting a mask on that they're somehow doing something wrong. Commissioner Sachs, you're recognized.
Thank you, Vice Mayor. We are all county commissioners, and even though we represent different districts, we all represent the county. So I'm going to ask Commissioner McKinley, what can we do together to help the people in your district get more vaccines, either to them or to have them vaccinated? Because when somebody in your area is suffering because they can't get to the vaccines or because they're not comfortable getting it, that affects all of us. So if you have any ideas, or if anybody here on this commission would need help from any of us, we're here, and I'm certainly here to help you in whatever way I can to maybe find that tavern will give you a shot and give you another shot. I don't know, but whatever we can do to help out, I'm here for you.
Commissioner Sachs, I appreciate that. It's also pockets of Commissioner Bernard and Commissioner Weiss's district as well. So I think if we just put our heads together and come up with some creative ways to target those neighborhoods, that's probably the best way we can serve. I learned from the farm workers. And again, huge kudos to our former DEM director, Jared Moskowitz, for working on that with me, along with Dr. Alonso and Mary and the healthcare district. It was successful because we brought the vaccines to them at a time of the day during the week that they were available. We made it convenient. And we removed some of the barriers and we're able to get them vaccinated. That's what we need to do. That is the best way to target some of these harder to reach communities.
It's very true, because I know that I represented parts of the area that now are in other commissioners' districts, and I know the community centers well, I know the churches well. So if there's anything that we can all do as a group or individually to help each other, I'm here for you all. First I want to say thank you to the Caridad Center, because Sunday, the Caridad Center bussed hundreds of farm workers, most from Central America, to the Caridad Center to get their vaccinations. And it really works. And they had doctors there, or nurses, to assist those who were pregnant or were about to get pregnant, to advice on whether they or not they should get the vaccine. It was hundreds were vaccinated, and that seems to be the way to do it, is to bring it to them or bring them to a central area and take care of it that way. I have a couple of questions for you, both you, Mary, and Dr. Alonso. You mentioned 1.9 tenths is a death rate that we have here from the coronavirus. That seems incredibly low compared to other areas in our county that are suffering from cardiovascular or even death rates from auto accidents. Is that, and I don't have your expertise. Mary, how does that compare to just people dying on our roadways here, pedestrians, bicyclists, from other types of accidents? How does that compare to that 1.9% of a death rate, if you know?
Well, I mean, we haven't done throughout this process any comparisons of any other illness or injury throughout this process. We've really been focusing on COVID-related issues. I can tell you that 1.92% is the individuals that are residents of Palm Beach County. Based on the number of individuals that have tested positive throughout this process, that figure is derived from the number of positive residents we've had in the county, and then compared to those that have passed. And we've seen that decline drastically since we've started providing the vaccines. We've really seen that plummet since December. So, I can't give you a comparison of any other disease or illness or injury. I'm sure those statistics are out there, but I just wanted to share with you how we're coming up with that figure.
Good, that's very, very good. And again, this is to Dr. Alonso, and this feeds off of that last question I asked Mary. In comparison to the strains of other communicable sicknesses, such as the common cold or the flu, are we on that plateau now where coronavirus because of the vaccinations, are we there that it is almost similar or maybe better than the strains of catching the common cold or a flu, all of which are respiratory communicable sicknesses?
We're getting there. We're getting very close to that. But the fact is that this can go up at any moment if we let our guard down. So the difference between a very low death rate and the fact that this has killed a lot more people than any flu, a regular flu season, is very significant. And globally, the effect that it's had is probably the worst pandemic we've ever had. So it's difficult to just isolate that into 1 month or towards the end. I mean, this will not be over until we have herd immunity like we did in 2009 when we finally vaccinated enough people with H1N1 to be able to say it's over. So it will not be over until that reaches that herd immunity, which we'll find out what it is. Some people are saying 80%, others are saying 70%, but it has to be up in that higher number. So that's the key. It's very difficult to just isolate it in one county or in one small district, right? I mean, our county is bigger than some states, so that you have to put that into perspective. So it's the number of deaths that has occurred and the fact that it's happened globally. I mean, look at India, right? Right now.
We can't stop people from coming into our state or our county.
Right.
At this point, who are coming from areas like India or other areas that are suffering from this. So it's up to us, in other words, to get vaccinated. Another question, has there ever been a vaccine that has been as effective as the ones that we have now? And I'm thinking of the two, major ones. I'm not necessarily thinking of Johnson & Johnson, but 95% is pretty high.
Yeah, and this is just one component, right? This vaccine only has the one component to create the antibodies against the COVID. The MMR vaccine, which is given to kids, the measles, mumps, and rubella, comes close, but it's a combination. The measles is a very highly effective, very similar to this. But this has the advantage that the Moderna and the Pfizer that use the messenger RNA and the other vaccine that also uses a similar method, that idea of being able to directly create antibodies against a specific protein is unique. And that's going to revolutionize vaccines from now on.
So in other words, what you're saying is that somebody who gets the Pfizer or the Moderna has probably the highest protection against the coronavirus than someone who would get a flu shot at their local CVS.
Oh, yeah, the flu shot's only about 60%.
Because I don't take
If we're lucky, if we get the right combination in that
Because
flu
there's
shot.
thousands of strains of flu, but on the coronavirus, we have that one, and we have this amazing vaccine. And the last question is this, really. We talked about the kids not getting shots. They don't want, they're superheroes. They don't get it. Do we have, or do you recommend that our colleges and our schools mandate that students have this vaccine before they go, knowing that our public schools will say no shots, no school? They have to have shots for other communicable diseases. And that age group you're talking about also brings in college students, which come together in great masses of students. Would you recommend that our schools, our public schools, secondary schools, colleges would also mandate that if they want to come and take a class, an in-person class, not a remote, that they need to have a vaccination?
Only the private schools are able to do that. At this point, there's no federal or state resolution to go in that direction. Especially now, anything that you mandate automatically becomes a lot of resistance, and I think detracts from the advantage of the vaccine as opposed to helping it. We're living in a very unique time, and at this moment, that would not be a recommendation.
Mary, how about from your perspective and your position? Do you think that if in fact the lack of vaccinations among this age group that attends schools, public taxpayer-paid schools, should have a requirement that for in-person learning that they should show proof of vaccination?
I couldn't speak to a requirement, as Dr. Alonso said, but I think the fact that we're working with our healthcare district partners, they're working with the school district now, and as well as we'll work with the private schools and those charter schools to provide easy access. And that's really our focus right now, that those students, the parents that want to take their children to get vaccinated, all those plans are being put in place now to make that access easier for those that can take it and want to take it.
So in other words, just educational influence, but the students don't have to wear masks whether or not they're vaccinated. And that would be your recommendation for public, which is charter schools as well, public schools as well as colleges and universities.
I don't
Commissioner
make decisions for the school board or for anybody else, and that, as a matter of fact, I don't make decisions for you guys up here either. I just give you the facts and you make those recommendations.
Doctor, as director of the healthcare on behalf of the state, I'm just trying to get
Yeah.
these kids
Commissioner,
vaccinated.
I think we've been preempted on this particular subject, and I think putting both of these people on the spot really is not going to solve what is certainly a point that we are all frustrated by, which is we are working under the guidelines set up by the governor. We can't ask for a vaccine ID card, and we have to, as the county administrator has stressed, rely upon people to make the right decision, and we can't look to them to prove that they've been vaccinated or not. And I think the school district is also going to be wrestling with the same issue as far as how they're going to address their students returning in the fall. I think they've already signaled that they're not going to require masks, and it's going to be dependent upon the parents to make a decision how they're going to protect their children. But I think it's outside of the control of this body to try and make any decisions that are going to impact either the school district or anybody else at this point.
I understand, Vice Mayor. I just wanted to have the opinion from the healthcare district and also from our emergency medical. So if maybe forthcoming, after you review these issues, then if you could at some point give us an opinion of what you think, because the problem is this age group, we all work together to find solutions. That may be a solution, but it depends on what your opinion is as you're in your official position.
I will tell you that mandated vaccines are done through the academy and through the CDC and through the advisory board that they utilize. The flu vaccine has never been mandated in any schools. So I doubt that this vaccine will ever be mandated in the schools.
Thank you. And Mary, be the same. Thank you very much. Thank you.
Thank you, Commissioner. Commissioner Marino.
I'll try to be brief. Can you please reiterate the procedure for those who may not have an ID to get a vaccine? And do we have a different procedure for people that are out of state?
There is no different procedure for people that are out of state. Anybody's welcome to come get the vaccine now. That is the official ruling from the governor that requested that to happen, as well as from the feds. There are locations that are requiring people to continue showing IDs and proof of residency. They should not be doing that. I don't know if they're doing it privately, but if they have federal or state vaccine, they should not be doing that. What was your other question?
Well, I reiterate the procedure for those that do not have an ID.
Well, the ID, you need to be able to show what age you are, but if you don't have an ID, if you don't have anything at all, a passport or anything that shows what we recommend, for example, if you're homeless and you've lost everything, the Homeless Coalition or through the churches, there are ways of having a letter being written for you, identifying who you are and where you're living at, who you're living with, and you usually have some kind of documentation to show your date of birth or your medical records or something that will help you to get that. So if you have that problem, you should call your Homeless Coalition, or you can call your church or any one of the agencies, some of the community help that is available, the Lord's Place. There are many, many places that help people who don't have identifications to be able to get around and get medical services and get the things that they need. There's lots of us out there that will help them to get this.
Okay, thank you. And Palm Beach County, we are known for our tourism, and earlier you talked about how possibly having the ability to do shots at events. So is there a way to coordinate with Discover the Palm Beaches, the Sports Commission, the TDC, knowing what events are coming here? And the caveat to that is it would have to be a J&J shot if you're coming from out of state, because you're probably not coming back again. If you're playing in the Cal Ripken 10U World Series here in Palm Beach Gardens, you're coming for a week, so you can only get one shot. You're not going to come back. But is there a way we can identify the J&J shot for events like that?
We are definitely, as a matter of fact, there's one coming up. There's a baseball team that's coming and playing, and we're going to vaccinate them. Unfortunately, they're only going to be here a week, and remember, the vaccine takes 14 days for it to work, so we're giving them the vaccine, but they're going to be gone. But that's okay, they're going to be vaccinated. So at this point, we want to vaccinate folks.
J&J then?
Yes.
Okay. So then I guess my question, suggestion, whatnot, is to continue to work with the Discover the Palm Beaches, the TDC, and the Sports Commission to know what events are coming so that we could possibly do that at more events in the future.
Absolutely.
Okay, thank you.
Commissioner Baker, County Administrator, you want to have one of these seats?
Go for it.
Commissioner Marino, we do work very closely together, but I also want you to know that a lot of the teams that are coming in on their end, they have to have vaccines done in their country, and we coordinate those efforts because we want to make sure people coming into our community that we're inviting and paying to come into our community, that they're also taken care of on the health side before they get here.
And to that point, I remember that our supervisor of elections, Wendy Link, as she was changing over her voter machines, was bringing those machines out to the ballparks and other venues so that people could get an idea of how to vote in the upcoming elections. And certainly that kind of a pop-up vaccination site makes tremendous sense, and whether it's a one-shot deal, certainly that's the best way to go with a J&J, whether they're staying here for 14 days or not. And again, anything we can do to improve the number of people who accept the vaccine, the better. Commissioner Bernard, and I hope we're just about done here.
Thank you, Mr. Vice Mayor. Commissioner Sachs had asked some great questions in regard to vaccinations and specifically the younger folks. I know for me, as a parent with 3 kids in the school system, I would hope that Dr. Alonso and Mary don't weigh in on whether or not kids should be vaccinated in the schools, because, this is a decision that parents and families would have to make. And I would hope that, the Board of County Commissioners, stay out of that decision and let, the federal government or the CDC make those decisions, because, these are tough decisions that families have to make.
Yeah, even when there are mandated vaccines that have to be done, the family always has the right to refuse those vaccines. And in that case, the parent is told that if there's an outbreak, then their child has to be out of school. And so the same thing would happen with the vaccine now. Like I said, we will quarantine individuals if there's contact or a problem in a class, and those kids would have to go home.
Thank you.
Very good. I see no more lights, so I'm going to say we are done with this subject for today. Thank you so much for your information, and we appreciate it, and we look forward to the day that we skip this item on our agenda. Okay, I'm going to look for a motion to receive and file proof of publication. I have a motion by Commissioner Weiss, second by Commissioner Bernard. All in favor, all opposed. That passes 6-0. We now move on to Palm Tran. There is a staff recommendation for a motion to approve electronic grant application, disclosure of lobbying activities, some budget transfers. I'm looking for a motion to approve. I have a motion by Commissioner Weiss, second by Commissioner Bernard. All in favor, all opposed. That passes 6-0. You're done. Okay, we're moving on to the county attorney. We have a motion here that we're going to approve a county attorney designate. Do I have a motion to approve?
Motion.
Motion to approve by Commissioner McKinley, second by Commissioner Sacks. All in favor, all opposed, passes 6-0. Next
Thank you.
item. You want to make a comment?
I just wanted to say thank you. It's always time for gratitude, and I just wanted to throw that in there. And I'll thank you in advance for the next one as well.
Okay. Would you like to say anything about 6A2? No. Do I have a motion to approve the contract for professional
So
legal
moved.
services? I have a motion by Commissioner Weiss, second by Commissioner,
That McKinley person, yeah.
McKinley. Okay, you get it. All in favor? Oh, we have a conversation. Yes, Commissioner Bernard.
Mr. Vice Mayor, I will not support this item. Okay?
Did you want to discuss it, or would you just like to show your dissent on that?
Yes.
Okay. We're going to have a vote. All in favor, all opposed, show that as a 5-1 with Commissioner Bernard. Wow. Commissioner Bernard dissenting. I'm going to need a seating chart up here. Okay. Next item. It's a item on environmental resource management. Commissioner Marino?
When we have discussion, I'd like to just make a comment.
Okay.
Thank you.
You're entitled. Do we want to have a presentation on this? Let's have a brief presentation. Brevity is the key to that sentence.
Vice Mayor, we can do brevity. Good morning, Commissioners. Pat Rutter, Assistant County Administrator, with Deb Drum, ERM Director, Mike Stahl, your Deputy Director, Scott Stone from County Attorney's Office, and then Jenna McNeil, one of our program supervisors at ERM as well. They've all been instrumental in preparing this, and with that, I will ask Mike to walk you through the amendments to our floating structure ordinance.
Good morning, Vice Mayor, Commissioners, Administrator Baker. Yes, so this morning we are pleased to present to you a proposed amendment to the Cindy DiFilippo floating structure ordinance. To begin, I think it's important to clarify what a floating structure is. A floating structure is an entity which is not primarily used as a means for transportation on water, but which serves purposes or provides services typically associated with a structure or other improvement to real property. Floating structures are expressly excluded from the statutory definition of a vessel. So the existing ordinance and the proposed amendment that we are presenting to you today do not apply to derelict vessels. It does not apply to illegal anchoring or mooring of vessels, and does not apply to live-aboard vessels, just floating structures. So again, the existing ordinance was adopted in 2015, While it was a tremendous step, it did have some limitations associated with it. Let's see. So it was only enforceable on submerged lands that are owned by the county or other waters within the jurisdiction of the county. Enforcement was problematic because it's difficult for law enforcement officers to know where the jurisdictional boundaries are when they're patrolling on the water. And when enforcement occurred, owners would simply move the structure across the county's jurisdictional lines and essentially concentrate those structures outside of the county's waters. And then a real issue was that it did not include authorization or provisions for removal of the structures in violation. So one of the challenges with floating structures, unlike vessels, is that they are not registered as a vessel with the state. They do not have hull ID numbers. So it is very difficult to track ownership of these structures. So in the development of the amendment, in November of 2019, the BCC, due to ongoing issues and municipal concerns, the BCC directed staff to review and revise enforcement of the floating structures. So we started by reviewing existing ordinances statewide and identified some of the most applicable elements to Palm Beach County. Originally, the amendment started as an opt-in. We did not want to take a heavy-handed approach with our municipal partners. However, as we were going through the development process and we were talking with our stakeholders, we reached out to League of Cities, PBSO, it was determined and decided that we would change to an opt-out for regulatory consistency and for ease of enforceability. So an overview of the proposed changes. The amendment will expand the prohibition of floating structures in waters of the county within unincorporated and incorporated areas, excluding marinas, permitted mooring fields, privately owned docks, or privately owned submerged lands. It establishes a consistent set of regulatory standards countywide. This minimizes the potential for localized concentration of floating structures to other areas or municipalities. It also enables law enforcement or any code enforcement officer acting within their jurisdiction to enforce. Floating structures in violation of the ordinance will have a notice placed on them, giving the owner 14 days to remove it, or it will be removed. Prior to tropical systems, the owners will be given 24 hours notice before removal. Municipalities do have an option to opt out of the ordinance, either by adopting their own floating structure ordinance or passing a resolution stating that they are opting out of the county's ordinance. This last bullet I really want to highlight. This ordinance is a regulatory tool to facilitate enforcement by the municipalities. The county is not assuming enforcement responsibilities within incorporated boundaries. We have been very transparent about this going back to the original stakeholder meetings. We also made it very clear when we presented to the League of Cities, just because this is a county-wide ordinance, the county is not assuming these enforcement responsibilities. As far as our timeline, we kicked off our efforts in April of 2020, as I said, with a review of existing ordinances. We initiated the stakeholder input and interagency coordination through December of last year. And then we had approval by the county attorney's office of the initial draft in March. In April, we distributed that draft to stakeholders and requested comments. And then today we are here with you, for the preliminary reading and requesting approval to advertise for public hearing on June 15th. I do want to mention that we have continued to receive some feedback from some key stakeholders as recently as the end of last week. So we do anticipate that there may be some minor edits, nothing that would change the intent of the ordinance, primarily clarifications. But we will provide a final markup of the proposed amendment to the BCC and to all of our stakeholders prior to the notice for public hearing. And then finally, as far as our coordination and outreach, again, our stakeholder meetings began back in July of 2020. That included representatives from a number of municipalities, as well as the Marine Industries Association, lagoon keepers. There were quite a few that participated initially. And then as we worked through the process, we had coordination meetings with League of Cities, as I mentioned, PBSO, Parks and Rec, PZB, and obviously the county attorney's office. So again, we distributed in April a draft to the League of Cities, as well as to the known stakeholders. And then on April 21st, we presented the draft ordinance to League of Cities and received a unanimous vote to not object to the amendment. That is our presentation, and we will entertain any questions you may have.
Very good. I see Mr. Radcliffe is in the audience, as he usually is. Are there any comments from the League of Cities, or you're satisfied? No, we're satisfied. Okay, very good. Then, okay, Commissioner Marino, you're recognized.
Well, for the public's benefit, I'd like to highlight the fact that this ordinance was named after the late Cindy DiFilippo, aide to District 1. She worked very, very hard on this. She was passionate about it. She was also a wonderful member of volunteer staff at the NW Runner Tutorial Center, which is how I got to know Cindy many, many years ago. Additionally, I'd like to thank and Parks and Rec staff for their extensive and collaborative efforts in getting this done, along with law enforcement, FWC, and the municipalities to get this developed. So those are my comments, but I just wanted to give a shout out to Cindy's family, who is still with us, and say that she was special to all of us, and thank you for putting her name on this.
Thank you, Commissioner Marino. Commissioner McKinley?
Yeah, I just had a question for Mike. We've got marinas in Pahokee and in Belglade, so were they included in the stakeholders meeting, and was FWC because of Lake Okeechobee?
We have coordinated with FWC throughout the process. In fact, we started with FWC to find out where to go and find ordinances, to sort of really start looking. And then we have relied heavily on League of Cities. There was representatives, I believe, from South Bay and I believe Belglade that participated in that as well. So for the marinas that are out west, the ordinance would not be applicable in a public or private marina. So it would just be outside of those waters.
Okay, thank you.
With that, I'd just like to make the motion.
Very good. So there's a motion by Commissioner Marino to approve on a preliminary reading and advertise for public hearing on June 15th, 2021 at 9:30 a.m. Do I have a second? Second by Commissioner Weiss. Seeing no further, yes, Commissioner Sachs?
No, it's great.
Okay, very good. We're going to call a vote. All in favor, all opposed. It passes 6-0. Thank you very much. Okay, time for our airports. Item 6C1. Does anybody want a presentation? No. We see no presentation. I have a motion by Commissioner Weiss, second by Commissioner Sachs. That is on item 6C1, A and B. All in favor? All opposed? That passes 6-0. You are excused. Okay, moving on now to 6D1. This is an item near and dear, I'm sure, to Commissioner Bernard. Do you want to move this?
Mr. Mayor, I'd like to make a motion to approve item 6D1 and state that neither the taxing power nor the faith and credit of the county nor any county funds are pledged to pay the principal redemption premium, if any, or interest on the bonds.
Very good. Do I have a second? See a second by Commissioner Weiss. All in favor? All opposed? We have a 6-0.
Mr. Mayor, I'd like to move to approve item 6D2 and states that neither the taxing power nor the faith and credit of the county nor any county funds are pledged to pay the principal redemption premium, if any, or interest on the bonds.
A motion made by Commissioner Bernard, second by Commissioner McKinley. All in favor? All opposed? 6-0. It passes. Next item, 6D3. Commissioner Bernard, go ahead.
Mr. Mayor, I'd like to make a motion to approve items 6D3A, B, and C.
Okay, do I have a second? Second by Commissioner Moreno. All in favor? All opposed? It's by 6-0. That one passes. This is how we get through an agenda. Okay, 6E1.
I have would like to move approval of item 6E1.
Where's
and
Mayor
say,
Wilson when you need
I'm
him?
so surprised, but I will be Mayor Wilson's light today. Happy to hear this news. Thank you very much.
And I echo Melissa on that one. I have it written here, shout out to Mayor Wilson.
All right, well, for those of you who don't know what's going on, as we're sitting here having our private conversation, for a long time, Mayor Wilson has been a strong advocate for getting lighting on State Road 80 between West Palm Beach and out in the Glades. There have been accidents out there aplenty. There are large vehicles out there that make driving out there, especially after dark, very hazardous. He has been a voice in the wilderness for years, and we finally worked out an agreement with FDOT and the county to help out with the maintenance of this, and Todd Von Laren is going to give us a little extra information.
Just one point of clarification on that. So first off, I want to thank Administrator Baker, Sherry Brown from OFMB, Masimba, Nick Uren from TPA for working out this agreement. So what this does is it transfers $100,000 to the TPA as part of some unexpended funds that we had here for the separation of TPA becoming a independent agency. What we have done is we've reserved the remaining $320,000 balance for an ongoing conversation that County Engineer Ricks is having with DOT and TPA to get the lighting on State Road 80. So that agreement with FDOT is not solidified yet, but we've pledged these dollars for our maintenance for the furtherance of that particular project. So we're hopeful that that will happen, but I just wanted to make sure that we were clear on that and thank TPA for their cooperation and working with us on this. So thank you for your support of 6E1.
Very good.
And if anybody doubts that that segment of roadway is dark, we'd be happy to take you for a ride some night. So, you know.
Very good, Commissioner McKinley. All right, so I had a motion by Commissioner McKinley, second by Commissioner Marino. No further discussion. All in favor? All opposed? That passes unanimously, 6-0. Mayor Wilson, I hope you're happy. And now let's see if we can't get those lights on for you. All right, we're going to move on to item 6F1. It's a motion to approve on preliminary reading and advertise for public hearing on June 15th, 2021 at 9:30, an ordinance of the COE on some additions, ministerial at best, as far as some changes to the code. Does anybody want to hear a presentation? I know we've all had individual presentations by Mr. Bannon. Good to see you, as always. Did you want to say anything before we bless this?
I just did how much, well, first I need to learn how to turn on the microphone. How much I've always appreciated in the 10 years we've been around the support of the county commission and county administration, the county attorney's office, and the League of Cities, because none of this happens without all of that support, and we appreciate it.
Mr. Bannon, I noticed that behind that mask you seem to have grown a little facial hair.
That sometimes happens in a pandemic.
I guess. Well, anyway, I'm looking for a motion to approve of the preliminary reading and advertisement. I have Commissioner Weiss saying yay. I have a second by Commissioner Sacks. Seeing no more discussion, all in favor, all opposed, that passed 6-0. We now move on to 6F2. And again, staff recommends a motion to approve a preliminary reading and advertising public hearing on June 15th, 2021, 9:30. Again, some COE updates. Anybody want discussion? Seeing none, I have a motion by Commissioner Marino, second by Commissioner Weiss. All in favor, all opposed. It is approved 6-0. Mr. Bannon, you're doing a great job. Now we move on to item 6F3. Staff recommends a motion to approve on preliminary reading and advertise for a public hearing on June 15th, 2021 at 9:30 a.m. Do I see any need for discussion? I have a motion by Commissioner Sacks, second by Commissioner Marino. All in favor, all opposed? We passed it 6-0. Okay, you guys are dismissed.
Thank you.
All right, we're now going to go on to public safety, and we are going to get a presentation on this, so we'll slow down a little bit, let everybody get settled and get their presentation ready. This is going to be a receive and file, not an approval, as per the amendment to the agenda today. Ms. Blakeney, it's always nice to see you when you're not talking about a pandemic.
One disaster to the next.
Oh, what's this thing called hurricanes? You are recognized.
Good morning. Can you hear me? Okay. So good morning. Okay, that's fine. I'll remove my mask. Okay, so good morning, Vice Mayor, Commissioners, Administrator Baker. For the record, Stephanie Shanahaw, Director of Public Safety. With me today, we have our Deputy County Administrator, John Van Arnhem, and as you've heard before, Mary Blakeney, our Director of Emergency Management. The item before you today will provide an overview of our preparedness strategies during this pandemic for the upcoming 2021 hurricane season. Today's presentation will include the following: an overview of the Division of Emergency Management, our 2021 hurricane season changes and predictions, our training and exercise program, how we deal with a hurricane during the COVID-19 pandemic, and how you can help us as commissioners. It's all about teamwork when it comes to the Division of Emergency Management. Our vision is to be a world-class emergency management agency, keeping our community safe and resilient by working together with our partners and the public as a team. We are blessed to have the support and resources of all of Palm Beach County to help us plan, respond, recover from disasters. We rely on all county departments as well as numerous state, federal, and nonprofit volunteer agencies to help us prepare, respond, and recover from major disasters. Contrary to popular belief, we are not the hurricane people, as evidenced by our response to the COVID-19 pandemic. We spend the entire year addressing our core 12 core hazards, which include natural hazards, technological hazards, and human-caused hazards, by planning with hundreds of stakeholder agencies, training responders and county employees, and exercising our entire emergency management system. The past year, our efforts were focused on COVID-19, but we worked with our local and state partners to develop a plan for protocols to address a hurricane during this pandemic. Although it was forecast to be an above-average year, 2021 ended up being a busy record season for all of us with 30 named storms. The National Oceanic and Atmospheric Administration Climate Prediction Center reviewed the last 30 years of storms and have created a new season average. Even with this new increased average, 2021 is expected to be a higher than average year. We need to be prepared and we need to be ready to respond every day of the year regardless of the seasonal forecast and regardless of the hazard. Our citizens rely on us for emergency shelters, as well as other countywide disaster functions that are a critical component of our emergency response system. The Employee Disaster Response Program, otherwise known as the EDRP, assists in identifying county employees and their skill sets and matching them with disaster-related roles. The EDRP can be used for any type of hazard or emergency and provides clear assignments and training to our employees. In fact, as a result of COVID-19, the EDRP was critical in identifying additional staff to support various response efforts during the crisis, such as testing and vaccination sites. The breakdown of county employees is shown in the table on the screen. While we have over 3,900 employees with department-specific disaster responsibilities as part of their job, we currently have a little over 1,400 employees enrolled and trained to serve our community in a variety of other disaster essential roles. County staff and other agencies, such as the Healthcare District, the Health Department, and the School Board, are also assigned to fill vital shelter roles. For shelter staffing, currently we have 67 shelter supervisors and 595 shelter staff support. The diagram to the right on the screen shows the organizational structure in place for supporting general population shelters. For non-hurricane season, which is typically December through May, is our planning, training, and exercise period. As part of the plan, train, exercise, evaluate cycle, the Division of Emergency Management has sponsored or conducted 17 training classes such as CERT, Incident Command for Senior Officials, Continuity of Operations Program Manager, and the Incident Command System Training, which is the ICS 300 or ICS 400. Those are examples of classes. Additionally, we have conducted 3 exercises, including a community emergency response team, a domestic security and family assistance and survivor care center. As of now, we are anticipating we will have 1 additional exercise focusing on a radiological event. Now I'd like to turn it over to Mary Blakeney to discuss some of our strategies for dealing with the hurricane during the COVID-19 pandemic.
Great, thank you, Stephanie. COVID-19 has placed an unprecedented strain on disaster management, our health, first responders, and other systems over the past year. Our hurricane will continue to exacerbate that strain. Let me take a moment to talk about the impacts of COVID that they've had on this upcoming hurricane season. Palm Beach County has been an active member of the statewide shelter coordination team that has addressed COVID and sheltering. This team, along with our collaboration with our local stakeholders, developed the following recommended strategies, which we have implemented. We implemented them the middle of last hurricane season, and will continue to implement them during this hurricane season. Closely examining the hurricane evacuation decision process, we may have to balance the evacuation risk against the risk of increasing disease transmission. Since stormwater and surge is the #1 killer in hurricanes, those who reside in evacuation zones, if told to evacuate, must evacuate. On the other hand, those that are not required to evacuate should not necessarily evacuate. We also developed a hurricane shelter contingency plan that includes non-congregate sheltering and congregate sheltering options for the general population, special needs, and pet-friendly shelters. We evaluated ways for ensuring physical distancing while not dramatically reducing our overall capacity. Provided additional screening and sanitizing efforts at all shelters, and have available procedure masks, hand washing stations, hand sanitizer, and cleaning supplies at all shelters. We revised our shelter operations training for our employees to include the new procedures, and we continue to evaluate staffing levels and available resources. We will continue to evaluate our plans to ensure the safety and well-being of our residents and employees in Palm Beach County. We are often asked, how can I help? No doubt several of you are thinking along those lines, so let me take a moment to answer that question for you. As the elected leaders in our county, we look to you to reinforce the actions and priorities of the countywide emergency response. We look to you to help get accurate messaging out to your constituents. Providing accurate, up-to-date information to our residents is one of our top priorities. We need everyone, including you, to strongly encourage everyone to be prepared, personally and professionally. So please take every opportunity to encourage your staff, family members, friends, and constituents to be disaster prepared. Our message is very simple, and so we need you to help us spread the word. Make a plan. Individuals need to know if they need to evacuate. If not, they should shutter up and stay in place. If so, they need to know where they're going within the county. We encourage county residents to evacuate in county. Have a plan for their pets and everyone in your family that may have a special need. Build a kit and keep it stocked year-round. Get involved, volunteer with community groups and your community, and be informed. Monitor the local media, our website, and our Twitter and Facebook and all of our social media sites for preparedness information and protective measures. While we're hoping for a quiet 2021 hurricane season, we cannot let our guard down, and we need to be ready for anything at any time. I hope today's presentation has given you confidence that Palm Beach County is developing strategies every day and is ready. Thank you for your time today. We'd be happy to entertain any questions.
Thank you, Stephanie, Mary. That's a good reminder for our residents that hurricanes are pretty much a fact of life here in South Florida. I'm seeing no lights, so I think that you were pretty thorough in your presentation, and we'd like to thank you. And so at this point, I'm going to ask for a motion to receive and file. Moved by Commissioner Weiss, seconded by Commissioner McKinley. All in favor, all opposed? It is approved, 6-0. Okay, that takes us to the end of our formal agenda. It's now time for commission appointments. And so we're going to go in reverse order. I'm going to go to Commissioner Bernard for District 7.
No appointments, Mr. Vice Mayor.
Thank you. Commissioners for District 6.
No appointments.
Thank you. Commissioner for District 5.
Thank you, Vice Mayor. And for Commissioner 5, I'm going to reappoint Dr. Lori Vinegar to the Planning Commission.
Second.
I have a second by Commissioner Bernard. All in favor, all opposed, passed 6-0. That's it? Okay. I'm just going to formally pass the gavel to Commissioner Weiss for a second. And Commissioner for District 4, I'm going to ask for an approval for Daniel Hostetler to the TDC as a member of that board. I have a second by Commissioner McKinley. You can't do it. Here, call a vote.
All in favor? All opposed? It passes 6-0.
Good job. All right, I'll take the gavel back.
There you go.
All right, District 3 is not here. Anybody have anything for Mayor Kerner? No? Okay, District 2?
None.
Okay, District 1.
Yes, please. I'd like to appoint Nancy Bourne to the Advisory Commission on Women.
Second.
I have a second by Commissioner Weiss. All in favor, all opposed, 6-0. Anybody else? All right, we seem to have gotten through that pretty fairly. All right, staff comments, administration comments.
No comments.
Oh, come on, you must have something. Okay, County Attorney.
I actually do something very important to let you know. Unfortunately, we were unable to resolve the issue with Palm Beach Gardens and the impact fee and the mobility fee issue. So today we will be filing the lawsuit in accordance with the board's direction.
And just for clarification, that's against the gardens,
I'm
not...
sorry, yes, the
okay,
City of Palm Beach
landowners
Gardens.
or anything like that.
Yes,
Okay.
and I wanted to thank the commission, District Commissioner Marino, for trying to get us to get to some resolution outside of litigation, which is always preferable, but unfortunately, we just discovered this morning that we cannot do that.
All right, well,
So
I
it's-
don't think it's a surprise to many of us that this is going to wind up in court.
No, and David Audi was actually walking the case over to file. It may already be done.
All right.
Thank
All right, it's unfortunate, but I guess we'll finally get this resolved. And for anybody who is trying to figure out what we're talking about, there's a discussion about the impact fees and whether impact fees can be diverted into mobility fees. And while many of us on this board are strong proponents of mobility, there is also a need to build out a road system, and so that will be something that the courts will straighten out. That being said, we're going to move on to commissioner comments, and we'll go in chronological order this time. So Commissioner Marino, you're up.
I'm going to be quiet today. I have no comments.
Oh, okay. Commissioner Weiss, you have anything?
Yes, I do. I'd like to request an off-site proclamation declaring May 19th, 2021 as Pace Center for Girls' Day in Palm Beach County.
Sounds lovely. I have a second by Commissioner McKinley. All in favor, all opposed? That is passed 6-0.
You want me to take care of these two?
Yeah, please.
Okay. And then on behalf of District 3, I have two requests. Request for off-site proclamation declaring the week of May 16th through 22nd, 2021 as Emergency Medical Services Week in Palm Beach County, and a request for an off-site proclamation declaring May 2021 as National Drug Court Month in Palm Beach County.
Okay, motion made by Commissioner Weiss, second by Commissioner McKinley. All in favor, all opposed? 6-0. Would you take care of the next one, please?
Yes, sir. On behalf of District 4, I would like to request an off-site proclamation recognizing September 2021 as the 50th anniversary of Junior League of Boca.
I will second that one.
I knew you would. Very
Say
good.
we're 30 years older than the Boca League and the Palm Beach League. So you've got 30 years to catch up with us.
All right, so I have a motion by Commissioner Weiss, second by Commissioner McKinley. All in favor, all opposed, 6-0. Okay, Commissioner Sachs, you're up. Anything?
Thank you. No, I'd just like to announce that today at Falk Center for Counseling, there's going to be a butterfly release in honor of mental health in our county. And I think it's a wonderful center, and it's going to be a very extraordinary day. Thank you very much.
And Falk does some great things and at a low cost for people who have mental health issues that they need help. And of course, butterflies are free, and that will be at 4 o'clock today at their headquarters over on Boca Rio Road. So everybody is invited to come and attend, and I will be there watching little butterflies. Commissioner McKinley, you're up.
Yes, thank you. Just a couple of comments. First, as it relates to impact fees, and really, you know, we had for the last decade, have had challenging pieces of legislation filed, and through efforts with the Association of Counties, we met jointly with the Executive Board of the Florida Home Builders Association. And so the legislation that came out this year, while everybody didn't walk away extremely happy, was definitely a compromise, and so hopefully that'll help with other impact fee decisions in the future. Also want to thank Phyllis Choi. She's a member of the Palm Beach County Housing Authority. Her daughter's also a very good friend of mine from Junior League of all things, but she's collected 500 books so far through a book collection, and she's going to be donating them to nonprofits in the Glades to help prevent summer slide for our students out there. Also want to make sure that you have on your calendar, I mentioned it last time, the Olympic baseball qualifiers that will be played at Ballpark of the Palm Beaches, as well as the Mets Stadium up in St. Lucie County. We're partnering with St. Lucie County on that. And for you Miami fans, Charles Johnson, who was a Hall of Famer, University of Miami player, MLB player, also played on the 92 Olympic teams. He'll be participating in some of the activities. So now to let University of Miami outdo us, but I tracked down, thanks to the coach at Florida State, the baseball coach there, Mike Martin Jr., connected with him last night and was able to track down Chris the Rook Roberts, who played on the 92 Barcelona team with Charles Johnson. So we'll have the Knowles and the Hurricanes hopefully represented at that. But I also was remiss, it's not the only Olympic qualifier that will be happening in Palm Beach County. Some of the equestrian sports will also be hosting Olympic qualifiers. And then I have a off-site proclamation declaring June 5th as Palm Beach County Pride Day.
Sounds wonderful, and I have a second by Commissioner Weiss. All in favor, all opposed, and that is a 6-0. Thank you, Commissioner McKinley. And of course, to our county administrator, those sound like beautiful places to have vaccination sites, and I'm sure that you will work with our healthcare partners to see if we can't get mobile vaccination sites at the Olympic qualifiers. Commissioner Bernard.
Thank you, Mr. Vice Mayor. I'd like to request 2 off-site proclamations on behalf of Mayor David Kerner.
Oh, we got those already.
Oh, we did?
Yeah,
Okay.
Commissioner Weiss got those.
All right.
You do yours now.
Mr. Vice Mayor, I'd like to request an off-site proclamation declaring May 24th through the 31st, 2021 as African American Golfers Hall of Fame and African American Collegiate and Youth Golfers Hall of Fame Week in Palm Beach County.
That's a mouthful. I have a second by Commissioner Marino. All in favor, all opposed, 6-0.
And just wanted to add on that, next week, Malachi Knowles will be hosting the African American Golfers Hall of Fame, and I'd like to welcome all of the guests to our beautiful county in District 7. Second issue, today's Haitian Flag Day. Last meeting, I had mentioned that this month is Haitian Heritage Month, so if you see the flags in the cars today, it's because this is Haitian Heritage Month, Haitian Flag Day, and I would like to encourage all the residents to attend some of the great events that's planned by the library. And finally, yesterday was my Chief of Staff's birthday, and I would like for everyone to wish her a happy birthday.
All right, very good. Is that it, Commissioner Bernard?
Yes.
Okay. Well, on that note, we have finished before lunch. See, I can do it. All right. On that, we are adjourned.